Hello, ladies and gentlemen. Eastern Circle Incorporation is March is known as Colorectal Cancer Awareness Month. Eastern Circle is excited to discuss this topic with the community. So let's sit back and have a discussion. I would like to focus on colon cancer symptoms. You might see changes in bowel habits such as diarrhea or constipation, blood in your stool or rectal bleeding, persistent abdominal discomfort such as cramps or gas pain, unexplained weight loss, fatigue or weakness, feeling that your bowel doesn't empty completely. Why early detection matters? Screening can detect precancerous polyps before they turn into cancer. Early stage colorectal cancer is highly treatable. Delayed screening increases the risk of late-stage diagnosis and complications. And we should all encourage family discussion and proactive health decisions. Let's now discuss who is at great risk for colon cancer. Who is at increased risk for colorectal cancer? People with one or more family members who have had colorectal cancer. Family history of colorectal cancer, example, genetic syndromes like Lynch syndrome or familial adenomatous polyposis, known as FAP. Those with strong family history may need earlier or more frequent screenings. Certain type of polyps removed increases risk of colorectal cancer. Individuals with these polyps need another colonoscopy in 3 years. Some may need screening sooner or later. It depends on the type and the size of polyp. This is an example of a polyp in the colon or rectum. People who have had colon cancer are at increased risk or higher risk for reoccurrence and need regular screening. Those who have had radiation therapy to the abdomen, pelvic area to treat other cancers need early screening. Screening should begin 10 years after the radiation or at age 35, whichever comes first. They may also need screening every 3 to 5 years instead of the standard 10 years interval. What I'd like to discuss right now is test options for colorectal cancer screening. And these options are visual structural exams of the colon and rectum. And these exams are done via colonoscopy, and this is done every 10 years. CT colonography, which is a virtual colonoscopy, and this is done every 5 years. And sigmoidoscopy, also done every 5 years. Test options for colorectal screening. The other test options for colorectal screening I'm going to talk about is stool-based tests. And these are highly sensitive fecal immunochemical tests. One is done every year. Another one is the guaiac-based fecal occult blood test. And this is also done every year. And thirdly is a multi-targeted stool DNA test with fecal immunochemical testing. And this test is done every 3 years. If the stool test based results is abnormal, a colonoscopy test is needed to complete the screening process. So if it's not abnormal, the stool test will be done every year or every 3 years, but once abnormal, a colonoscopy test is needed to complete the screening process. Ladies and gentlemen, we have come to the end of the topic or discussion on colorectal cancer screening. We recommend that you get regular health screenings done. For colon cancer screening, it is done, if it's stool-based, it is done yearly, depends on the type, or every 3 years if it's a DNA stool test. If it's colonoscopy, it's done every 10 years. If a polyp is removed, depends on the type of polyp, the size, it will be recommended that it's done every 3 years or maybe more often. So get your regular screening test done, have a discussion with your doctor or your PCP, the type of testing that is necessary for you. This is the references that we obtain the information from. If you are interested in looking into more information or looking for more information on colorectal cancer, these are some of the sites that you can reference. Thank you once again for tuning in and allowing us to have this discussion with you. Eastern Circle Incorporation wants to extend heartfelt gratitude for your attention and engagement with our educational segment on colon cancer awareness. Your willingness to learn and spread awareness plays a crucial role in early detection and prevention. By staying informed about symptoms, risk factors, and screening options, you empower yourself and your community to take proactive steps towards health and well-being. Together, we can make a significant impact in the fight against colon cancer. We want to thank you for being part of this important conversation. Thanks for watching, everyone. Stay tuned for our next upcoming topic in April. See you soon. Have a good day. Stay healthy and be safe.